Hi everyone. Today in this video let us discuss one of the drug isosorbide mononitrate. What is this drug isosorbide mononitrate? Within the name we can observe the suffix nitrate. So this drug is one of the organic nitrate. Nitrate groups can be attached to organic compound which produce organic nitrates, and here this isosorbide mononitrate is having a single nitro group attached by an ester linkase. We have so many types of organic nitrates. For instance, one of the well-known drug is the glyceryl trinitrate, which is commonly known as GTN. This drug is also called as nitroglycerin, which is one of the drug of choice in the acute treatment of angina. And this drug is simply a glycerin chain attached with 3 nitro groups by ester linkase. Similarly, we have other organic nitrates such as isosorbide dinitrate, erythritol tetranitrate, and pentaerythritol tetranitrate. All these drugs are the organic nitrates with different number of nitro groups attached to organic chain. And here isosorbide mononitrate is one of the well-known drug for the chronic treatment of angina, and this drug is commonly known as ISMN. This isosorbide mononitrate is the active metabolite of isosorbide dinitrate, and this is the active metabolite which is useful in the treatment of angina. Now ISMN acts as vasodilator. So this drug produces vasodilatation which affects the function of heart. Isosorbide mononitrate can act on the veins as well as it can also act on the arteries. So it can produce the venular vasodilatation resulting in the decreased filling pressure so that the preload is going to be reduced. Similarly, this drug can produce arteriolar vasodilatation which results in the decreased pumping pressure, thereby afterload is going to be reduced. So ISMN can reduce both preload as well as afterload. And this drug can also increase the coronary vasodilatation, thereby oxygen supply to the cardiac muscle is going to be increased. Along with increase the cardiac oxygen supply, this drug can also reduce the cardiac oxygen consumption by reducing the cardiac work. That's why this drug can be used in the treatment of angina, where it can reduce both preload as well as afterload, thereby reduce the cardiac work. And this drug is having few of the advantages. ISMN is having no first pass metabolism. Nitroglycerin is having the high first pass metabolism. On the other hand, isosorbide mononitrate is having no significant first pass metabolism. So this drug can be given as a tablet, and this drug shows 100% bioavailability, and even the peak plasma concentration can be achieved within 30 to 60 minutes. Even this is not sufficient for acute treatment of angina, but in the chronic management of angina, isosorbide mononitrate can be given, where it can work within 30 to 60 minutes to produce vasodilatation and to relieve the symptoms of angina. So today in this video we are going to see how this drug acts, what is its chemical nature, what are the important precautions, side effects, dosage, all these things we will discuss in this video. First of all, what is the chemical nature of this drug? So this is the simple structure of isosorbide mononitrate. Here we can observe nitro group is attached by an ester linkase, but another group is the free hydroxyl group. That's why this drug is a mononitrate instead of dinitrate. And here the ring system is formed by fusion of 2 furan rings. So this is one of the furan ring and this is the other furan ring. So this ring system can be written as furo-furan. But where is the point of fusion? In order to show the location of fusion, we can give the numbering to one of the ring. So let us give the numbering to this ring. This is 1, 2, 3. And now let us label the sides of the other ring. So this is A side, this is the B side. Now if we carefully observe, the third and second side of the one of the furan ring is fused with the B side of the other furan ring. So we can write this as 3, 2B. So the ring system in the isosorbide mononitrate is furo 3, 2B furan. Then let us give the numbering to the main ring system. So this is 1, 2, 3, 4, 5 and 6. So a nitro group is attached by 6th position as a nitrate. So we can write this as 6-aryl nitrate. And hydroxyl group is present at the 3rd position, so 3-hydroxy. and all the elements are saturated, so hexahydro, and it is saturated at second, third, fourth and fifth position along with bridgeheads. So we can write this as 2, 3, 3A, 5, 6, 6A. So that is the complete name of isosorbide mononitrate. Now let us see the precautions of this drug. One of the important precautions of isosorbide mononitrate is that this drug acts as a vasodilator. So this drug may produce some significant hypotension in the patients, which is more observed in the volume depleted patients. That means the patients who are suffering with severe diarrhea or those patients who are using high ceiling diuretics. In such patients, the hypotension is more pronounced with the use of isosorbide mononitrate. And this hypotension is more pronounced when the patient is changing from sitting position to the upright position. In such conditions, care should be taken to avoid any accidental fall and injuries. And because of this significant hypotension, this drug can also produce some dizziness, fainting, and even it can increase the heart rate by reflex action. So reflex tachycardia can be produced by isosorbide mononitrate. But sometimes you can also observe bradycardia, which is a paradoxical effect. That means the quite opposite effect that can be observed with isosorbide mononitrate. It can also reduce the cardiac rate and even it can increase the angina. So care should be taken when this isosorbide mononitrate is prescribed for long term, as it can produce some significant hypotension. Similarly, this drug can produce some severe headache, which is commonly observed with many of the organic nitrates. But this headache simply indicates that organic nitrates are acting like vasodilators and they can relieve the symptoms of angina. Due to the development of headache, the patient should not stop the use of isosorbide mononitrate because headache is a pharmacological effect produced by this drug. And this headache is because of cranial vasodilatation produced by isosorbide mononitrate, since this drug acts as vasodilator. Another effect is observed on the heart. So ISMN can produce some ventricular hypertrophy. So in the patients with already any cardiac myopathy along with hypertrophy, in such patients this drug may further increase the hypertrophy, proliferation of cardiac muscle, which may result in the decreased cardiac output because of increased obstruction in the flow. So this may develop the symptoms of angina and even it can increase the myocardial infarction. So in those patients with any risk of hypertrophy, this isosorbide mononitrate should be carefully used. Now let us see the contraindications of this drug. Since isosorbide mononitrate acts as a vasodilator, this drug should not be combined with phosphodiesterase type 5 inhibitors. The drugs like tadalafil, sildenafil, vardenafil, evenafil, all these drugs are used to treat pulmonary hypertension as well as erectile dysfunction. And these drugs should not be combined with isosorbide mononitrate in order to avoid severe hypotension. Now let us see the side effects of this drug. As we have discussed earlier, this drug may produce a headache as important side effect, which is commonly observed in many of the patients. And it can also produce hypotension and dizziness. It may also produce some dyspnea, difficulty in breathing. At high dose, it can induce the nausea in the patients. As a paradoxical effect, ISMN can produce bradycardia. Even it can increase the chest pain and symptoms of angina. So in such conditions, this drug should be carefully used. Now let us see how it works. Within this vascular smooth muscle, MLCK plays an important role. This MLCK is going to be converted into MLCK activated form, which is then going to act on the MLC myosin light chains such that it can produce a phosphorylation of this chain, resulting in the production of MLC phosphate. Now this MLC phosphate can combine with the actin such that it can produce actomyosin complex. This produces a contraction of the vascular smooth muscle. Now ISMN acts as a vasodilator. It can release the nitric oxide such that this nitric oxide can stimulate the guanylyl cyclase system. This GC can act on the GTP such that GTP is going to be converted into cyclic GMP. Now this cyclic GMP acts as an important secondary messenger. It can deactivate the MLCK such that MLCK is converted to MLCK phosphate, which is the inactive form. Similarly, it can also inhibit the activation of MLCK which inhibits the formation of actomyosin complex. Even it can inhibit the entry of calcium into the vascular smooth muscle, thereby it can reduce the contraction. By all these actions, isosorbide mononitrate can produce relaxation of the vascular smooth muscle. So this drug can produce vasodilatation of both arteries as well as veins, thereby it can reduce both afterload as well as preload. By all of these actions, isosorbide mononitrate can reduce the symptoms of angina. How it is given? This drug is available as a tablet at different strengths such as 10 mg and 20 mg. The initial dose is going to be started at 5 mg. But this 5 mg given twice daily. After 7 hours, another 5 mg should be given. But in those patients who are having more body weight, the dose may be further increased to 10 mg given twice daily. The gap between the first and second dose should be the 7 hours in order to avoid the tolerance. This type of dosing is given to avoid the tolerance developed by this drug. Since the first dose and second dose are given within 7 hours gap, for the next dose on the next day, a 17 hours gap will be available, which reduce the development of tolerance by this drug. So by maintaining the nitrate-free intervals, the induction of tolerance can be minimized by isosorbide mononitrate. In this way, ISMN is given as a twice daily dosage regimen. The first and second doses should be given within 7 hours gap. After 7 hours, a 17 hours gap should be maintained for the next dose on the next day. So that's all about this drug, isosorbide mononitrate. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.